Okay, welcome to the girls. Today we are back on Zoom for a special reason, right, Jeannine?
Yes, we're back on Zoom. We keep them guessing where our next set is. And Rosie is sitting in today for Lori again. She couldn't be on the show, but we have a follow-up show that we have guests from all over the place today, don't we?
Well, Lori will be thrilled that she's replaced by a little fur baby because she loves her little fur babies.
She loves doggy.
If people remember, we have been following one of the patients of a lady that we know very well, Jean Paslawsky, and she was a candidate for a liver transplant. So we had her as a guest on the Grills months ago, and she told the audience all about how she felt and how she was typed and cross-matched and whatever, and how through the miracle of liver transplant, she was awaiting a liver transplant. And now today, we're happy to say that months later, we not only are going to have Jean back, but our first guest will be the doctor and medical director of the liver transplant program, Dr. Swaytha Ganesh. Doctor, thank you so much for taking time out of your busy schedule to join us today. For many people out there who may have liver disease and other problems, I know that with Jean, you sort of were in charge of all the coordination. So was she your first contact with getting all the ball rolling with this?
Yes, absolutely. Jean is an amazing lady. I saw her at UPMC Harrisburg. We do have 3 transplant outreach clinics, one based in Williamsport, one at Harrisburg, and one at Memorial, York. So I saw her in March or April of last year, where she had decompensated liver disease and she had swelling in her legs. So that's the first time I met her, and I met her for transplant evaluation. So she completed all the evaluation at Harrisburg, and we listed her for transplant at UPMC in Pittsburgh. And sometimes it doesn't correlate. The numbers of what they have doesn't correlate with how sick she was at that time. So even though she was on the wait list, she wasn't going to get a transplant at the right time, and she was deteriorating. And that's when we started talking about living donation for her.
Yes. Well, when we met Jean, she looked well. I mean, unless you knew all of the conditions that she had and all of the side effects and symptoms, you would never think it, because she didn't look like a typical liver transplant patient or someone who had liver disease. And she was just so knowledgeable and so ready and willing to share all this information with us. And I know the public we had a great response from that show. And now being able to follow Jean, what were some of the criteria that she had to meet in order to get this liver transplant?
Sure. Usually when we evaluate someone for liver disease, Debbie, we make sure that they don't have any extensive lung disease, like extensive smoking, causing emphysema on oxygen. And if they're overweight and deconditioned, that would be not absolute contraindication, but we have to make sure that they come to the right BMI before we can list them. Or if they have extensive heart disease, which is untreated, and if they're deconditioned, not able to walk. So those are some things which are contraindications for transplant. So when she underwent the transplant evaluation, we did an extensive lung evaluation. We made sure that her heart was okay. She had a stress test. She passed all the tests, and we know that she was going to do well with the transplant, and then we listed her. So she had lab work, X-ray, EKG, stress test, and CT scan, and HLA matching, and a lot of blood work to evaluate for some of the CMV and those opportunistic infections. So she underwent an entire evaluation process, which was over a couple of days, actually. And she passed all of them with flying colors, and we listed her for transplant.
That's the easiest part, I guess, of all of this, because next is, Jeannine, you're going to ask the question probably about how do you find the transplant donor?
The importance of being a donor. It saves lives, being a donor, right?
Absolutely. So the waiting list in United States, we have at least 15,000 to 17,000 people on wait list for liver transplant, and only up to 6,000 to 7,000 people get liver transplant. So there is a 25% of the people, they can die on the liver transplant wait list waiting for an organ. And I'm very passionate about living donation. So every single person I come in contact with, I talk about living donation, and finding a donor within their community or their support system is easier than we think, actually, because a lot of people want to help. So we actually, when we see a patient for evaluation, we start talking about finding a living donation on the first day when we meet with them. So when we met Jean, we did talk to her about living donation on day one. And sometimes they may not have donors ready to go because they may not have qualified donors, or they may not have the same blood type. So that's when we ask them to lean on their champion. Champion is someone in their support system who can help and be an advocate for them to find a donor. And we ask them to spread the word. Word of mouth works, social media, Facebook, Twitter, and we ask them to run like a rally or posters. So there are multiple ways. We teach them all the resources so they can find a donor within their support system. Could be anybody. They don't have to be related to them. Could be a friend or a cousin or a coworker or a neighbor. Or in fact, there is quite a number of patients who come forward reading a story on the Facebook, and they're altruistic donor. They are not directed donors, they're altruistic donors. They say, hey, I know there's a lot of people on your wait list. Is it okay for me if I'm able to, I'll donate a piece of my liver to one of the patients on your wait list. So we have quite a few altruistic donors who come forward like that. They're non-directed. They do not know anybody on the wait list, but they come forward. It's amazing.
So I guess it's relatively safe then.
It's yes, the living donor procedure itself.
Yes, and
yes,
just
absolutely.
like you said, like we only have one liver, but you could donate half your liver or some of your liver.
Yes, you're absolutely right, Jeannine. The liver has enormous capacity to regenerate. So when we match a donor to the recipient based on their weight and their blood type, what we do is that there is a portion of the liver taken from the donor given to the recipient. In the donor, the liver regenerates to full size in 8 to 12 weeks, and it takes maybe 12 weeks or so in the recipient. The liver completely regenerates, and that's just a very unique thing for liver. And that's why living donation is possible, and it saves lives.
That is the most important thing I think I'd like to get across today, as well as you, doctor, is that a living donor is so much different than a donor, say, they have it in their will or whatever, waiting for an organ transplant. This is totally different, where a piece of the liver is taken. So you're not giving up your entire liver. And it could be anyone. If you're healthy and you have in your mind that you think it could undergo this, so what does the donor need to do? What about the donor themselves?
Sure. The donors, you have to be between the ages of 18 through 55, but recently we went up the age to 60. And they just have to be relatively healthy without any chronic illnesses like HIV or lung cancer. Any kinds of cancer is a contraindication. And they should not have HIV or hepatitis B. And we make sure that they're not, they have to stop smoking 30 days leading up to donation. And they should not have any substance use disorder or active alcohol use disorder. It's okay for them to have social drinking, but they should not have extensive alcohol history or alcohol use disorder diagnosis. As long as they are in remission for 6 months to a year, they can still donate, but they should not be excessive alcohol. But if they have, hypertension or diabetes, we still consider them for donation. It's just that they should not have emphysema or extensive cardiovascular disease. So they should be relatively healthy.
And from the time that the donor is screened until the time that the surgery takes place, is the surgery taking place at the same time as the person? Okay, so it's taken right from the donor into the recipient.
Yes, it's done in 2 operating rooms. The donor is started, the piece of the liver is taken out by the surgeon, Dr. Humar, and then Dr. Hughes, who's working on the recipient, he's already in a different OR. So this liver taken from the donor goes into the recipient's operating room, and Drs. Humar and Dr. Hughes, they work on the recipient together.
And you mentioned the regeneration of the liver from the recipient. How quickly does that occur? Is the patient, the donor, is the donor watched for how many hours or days or whatever in the hospital to make sure that their liver is functioning properly then afterwards?
Absolutely. For the donor, majority of our donors are discharged between 4 to 7 days.
Ah.
So we watch their liver function tests, make sure that the pain is controlled and that their drain is removed and they're able to eat, and then we discharge them home. But they're followed very closely at the 3rd-month interval when they come in for an for the follow-up visit. We get a CT scan to make sure that the liver has regenerated.
And doctor, it's important to know if someone is interested in all of the information, because it is important to know what they're getting involved with. How do they start the process?
Sure, absolutely. If they want to be a donor, they can go into this website that brings them to the patient data sheet that has their name and information about their screening, like hypertension, diabetes, or BMI. That's one way to register to be a donor. But if they want more information on UPMC Living Donor and how to be a donor in the Champion program, they can just go into the UPMC website, click on the Living Donor Liver Transplant, and all the information on what Living Donor means, the outcomes, and the Living Donor Champion program. And all our contact information will be up there. And they should use that resources. It's easily available. They can go into Google, put in UPMC liver transplant, and then the Living Donor. There's a complete section and a great website for us.
We have a great interest in it. As we said, we've been following Jean Paslawsky, and we are going to speak with her. And as I said before, she's also very fortunate that she was able to meet her donor. So not everyone gets to meet their donor. I think sometimes the donors want to remain anonymous. Is that true?
Absolutely. There are so many altruistic donors. Some of them would like to remain anonymous, and we honor that.
And I have one more question. Once you donate part of your liver and it regenerates, can you donate again?
No. That's
okay, so one and done.
Once and done, yes.
One and done. All right. I just had that in my mind because I thought, wow, if it keeps regenerating.
Yes, why not?
Only share your liver once.
Yeah, only share your liver once. Well,
it's a good question, though.
Yeah. Well, thank you,
doctor,
so much for joining us.
Yes,
we may be interviewing you again at some point. We don't know. We're going to keep following Jean, and we are glad to be able to get the information out there. So think about donating your liver. Thanks, doctor.
Thank you so much for having me on the show. Thank you.
And when we come back, we'll have Jean, and we'll get to meet her donor. So we're very excited to meet the person who was able to really save Jean's life. So stay with us here. You're watching The Girls on SSP TV.
Welcome back to The Girls. Today we have a very exciting show. We've been following Jean Paslawsky, who was a guest on our show prior to this. And we had her as a guest a month before she had her liver transplant. Now 6 months have gone by, and Jean has pretty much recovered back to normal, whatever that is. And so we have joining us today is Jean Paslawsky. And also the greatest thing is we have her organ donor with us.
Yeah.
The liver donor, I should say, because it was partial. It wasn't a whole liver, but it was part of his liver. And his name is Jeff Methena. And he's coming to us from Florida today. So thank you to both of you for taking time to come back on the show and get us all caught up with everything. Jean.
Happy to be here. Happy to be here.
Thank you, sweetheart. I'm going to start with you, Jean. I gave a little summary of what happened. For us, it's just a brief little thing, but I want to know, and everyone wants to know, how are you feeling?
I'm feeling about 10 million times better than I was. I'm not 100%, but I'm so much better. It was immediate. When I woke up in ICU, I felt better. It was immediate. And now every day, unlike last year where every day got worse, this year, every day is getting better.
That is just so amazing to have seen you before and to see you now. Your color is so much brighter, and you were telling me all the different things that you're doing and places that you're going to, and you had to do all of that through some of the COVID also, and wearing a mask and different restrictions. So you had a lot of things to overcome in addition to what a normal transplant recipient receives, a living donor.
Yes. And now one thing I was told to my doctor is if I go anywhere with many people, always wear a mask. And if anybody comes near me with sniffles, I'm to ask them to step back. I said, no, I'll tell them to step back. And I wear a mask at all times with them. And if they don't have a mask, they don't get a hug.
Very nice. Well, Jean, how did this come about? Speaking with the doctor earlier and learning about finding a match and how this works with the liver transplant. Jeff is in Florida. So how did this come about that you guys were a match and that this worked out for both of you?
Well, I think God made all those details come together. In fact, I don't think that I know it because it was so extraordinary that you couldn't deny it. And I was just so grateful because he really saved my life. His yes saved my life.
Amen to
And
that.
Jeff, you're with us today. We thank you for your time. I know it took us a lot of time to coordinate the show with everyone's schedules. Thank God for Zoom. But thank you so much for your decision to be a donor. And, tell us a little bit about your background. How did you decide to become an organ donor in the first place?
Yeah, thank you for having me. So I decided to become an organ donor because a friend of mine, his stepmother, so it's a friend I had since middle school, she needed to have a liver. So they were looking for a donor. And at the time, I thought I was a match for her. So all my time in the military, I thought I was a certain blood type. And then later on, I find out I was not that blood type. So we were almost into a 2-year process going through the liver donation. And we've been through 3 or 4 hospitals before we ended up at UPMC. And UPMC had told us that she could do some treatments to be able to accept my liver because it was a different blood type. And then right after we were going to start those treatments, and they came up with the paired exchange program. And then we said we had a better match, and it's better to do the direct match than the treatment match. So that's when we said, yeah, we'd definitely be interested in that. And I think that's when we got matched up, which worked out great. So instead of just being able to donate and having, one person get a liver, we were able to get 2 people that needed livers get moved up because the list is long and it's hard to get to the top of the list. Your scores have to be very high, which is not a good thing, right?
Yeah.
So there were 4 people involved in this living organ transplant versus normally if it's 2. So when you're waiting for 2, that direct match, as you explained, this way you were able to help Jean, and then the person that you were going to originally give to, they got a liver from someone else. So it's just a matter of putting your organ information into a pool, in other words. And if it matches someone else, then that's it. So it wasn't directly meant for Jean. It was meant for anybody that it would have matched. Is that correct?
Yeah. So we were looking for another match pair or somebody that we can do the paired exchange with that would have a donor, or there was a donor that would be matched to Barbara, the person I was donating to. But I think this just kind of worked out, and everything aligned perfectly. I think we have a lot of the same background. I was in the Marines. She's got family in the Marines. My family has Polish in it. And she's Polish in her family too. So, it's just kind of weird how everything aligned perfectly for this.
God's plan, definitely. I think it's remarkable that you just decided, hey, I'm going to donate part of my liver. Tell us about the process for you, because we want people to know that are watching the show that if they aren't, an organ donor, or they're afraid to be an organ donor, if you can spread light, shed some light on the subject of being an organ donor for those who might, be hesitant to be on the list.
Yeah, it's a long process to get approved, right? So you have to go through. You can't just go in and say, "Hey, I want to donate organ." Right. You have to go through a lot of physical tests, but they also, check your overall health, but your mental health also, to make sure that you're suitable. And then they have to have a panel that votes on all the donors to see if you're a good donor or not. So you have to go through that whole process, which is long. But the overall process wasn't, as bad as I thought. The healing process wasn't as bad with us. It was a liver, and going into this, I didn't realize the liver regenerated until, I started looking into liver donation. But But for me, it was, a no-brainer. It was something I wanted to do. So, I was ready for whatever it was in the healing process, but it was actually, knock on wood, isn't as bad as I expected in the recovery. It was getting up and moving again. It was probably harder moving with all those machines attached, and trying to get your steps in and anything else. But
We-
it's definitely worth it.
We spoke with the doctor who coordinated a lot of this prior to speaking with you now, and we did learn how you go back for different checkups, and you will constantly be on the watch to make sure that you're okay. And so, how do you feel now? I mean, is everything back to normal for you?
Yeah, it is. I probably on my 3-month appointment when we first met, I was feeling, right back to normal pretty much. I had to be careful about lifting anything heavy because you have a risk of hernia because obviously cut in your stomach area. So besides that, I was feeling good. And, I think I was at 80-90% my liver size by 3 months. So
Wow.
I had adjusted my diet and been exercising just to be in shape for the operation. They ask you, step up your cardio, do some stuff so that when you're trying to recover, it's easier. So I had done that. I had to drop a little bit of weight as part of being approved. So I was able to do that, and I adjusted my diet. So post-operation wasn't that much worse for me. I think if I was eating a lot of greasy fried foods, spicy foods, things like that, it could have, your stomach might be upset by it because you actually lose your gallbladder as part of the liver transplant also.
Oh, that's interesting to find out. So you had a cholecystectomy and gallbladder removal along with a portion. How big of a piece did they take? Did they show you about how large of a piece of your liver was taken?
They take a whole lobe. So you have the left and right lobe. So they take, now I forget if it's my left or my right, but the lobe with the gall, and that's why the gallbladder goes, because it's attached to that lobe. So.
Exactly.
I see Jean and she's just glowing and she speaks so highly of you, Jeff. And I know, Jean, I don't want to use your word, steal words from you. So tell us how you're feeling and how blessed you feel that, Jeff came into your life.
Well, if he hadn't, I wouldn't have one. That's it, bottom line. And I told him when I met him, I could never stop thanking God for him because he was so kind and so selfless. And, he was kind of lamenting about his Marine Corps service and what he didn't get to do. And I said, look at me, Marine. I said, you saved my life. Don't you ever forget it. Never. And the people who prayed for me, who know me, they're still praying for both of us. And they will pray, and I will pray for Jeff and everybody he knows and all of his intentions forever. Forever. I could never express my gratitude enough.
When was it that you two were first able to meet? How did you arrange it?
It was at the 3-month appointment. It actually worked out. So we were both there at the same time. And it was kind of funny because I was supposed to be there the week before, and I was at the airport, and it was when all the air traffic controller systems went down that one day, and they grounded all those flights across the US. So I wasn't able to fly out to make my appointment. So they had to reschedule me for the following week. And then when I was there that week, the following week, going through my 3-month follow-up, my care coordinator came in and said, the recipient's here. Would you like to meet them? Or meet them? They're very careful because of all the privacy. They don't say her or him or anything.
Right.
They don't want to give anything away. And I said, yeah, absolutely, if we have time. And we did. So we were able to meet, though it was brief. Right. I think it was a few minutes in a conference room, but it was long enough to meet each other, exchange contact information, things like that.
We're happy that we were able to get everyone on at the same time through the magic of technology. And Jeff, it was so nice to meet you. We thank you for your time today. And Jean, it's always nice to see you too. I know we're running out of time on the show, but we will keep our audience updated on your progress. And I'm hoping that we can save or help save more lives with this show, Mom.
Yes, exactly. As the doctor had said, we gave information where if you want more information about becoming a living donor, you can get in touch with them. And also you could reach out to us if there's any way that we could direct you in getting any more information. We want to say thank you to both of you, first of all, again. And thank you so much, Jeff, for stepping up and being a hero. And you are, as Jean said, always in our thoughts and prayers. We have a great prayer group that we had started for Jean, and it's not only Jean, it's Jean and Jeff, the two J's. So, you're one and the same. You share so much. And we want to thank the doctors also for being able to do this particular surgery. So, Jeannine, do you have anything to add?
I would just add one thing. I would like to say to everybody, share the wealth of your health. Be a living donor. Don't just sign the card for when you die. You can be a living donor and you can save a lot of lives. Thank you. Thank you both for having us.
How
Well
about
said,
you,
Jean.
Jeff? How about you, Jeff? Do you have anything to add there in closing?
No, I definitely think, I want to thank you guys for having me on, but yes, definitely repeat that same comment. Everybody should think about it. It's something you can do, and you could really save a lot of lives.
That's great to hear. Thanks again, guys. You're watching The Girls. You can watch us again anytime at ssptv.com, and we'll see you next time.